Good afternoon. I'm Anthony Mingy, Senior Partner with Fitch & Associates, and on behalf of the firm, welcome to our Pinnacle webinar series. Today's presentation is Avoid the 10% Medicare Penalty, Best Practices for EMS Providers Now That Mandatory Cost Reporting is Underway, sponsored by Digitech. Before we get started, as always, I have a few quick reminders and announcements. First, we're excited to announce that registration is now open for Pinnacle 2023. This year's Pinnacle will be held July 24th through the 28th in San Antonio, Texas, at the beautiful JW Marriott Hill Country Resort. Don't miss exclusive pricing now through April 1st. Register early to save more than $200. You can learn more and register for Pinnacle at pinnacle-ems.com. We hope that you can all be down there to join us. And if you're one of our or one of your team members is looking to participate in the next ASM Ambulance Center Manager or CCM Communication Center Manager courses, now's your chance. The program begins August 28th with in-person classes October 8th through the 13th and week 2, December 3rd through the 8th in Oklahoma City, Oklahoma. You can register for those at fitchassociates.com. I want to thank each of our webinar sponsors. We're grateful to Digitech, a Pinnacle Platinum sponsor, as well as today's presenter. Thank you also to our learning partner, Ninth Brain, and our premier media partner, EMS One, who both provide support in bringing you these great sessions. Moving on to our presentation, as a reminder, we'll be answering questions at the end of the presentation. At the bottom of your Zoom window, you should see a few buttons: Chat, Raise Hand, and Q&A. The chat feature can be used to interact with your fellow attendees or presenters. If we share any links, we'll place them in the chat window as well. However, if you have specific questions during the webinar, please use the Q&A button. And now I'm pleased to welcome our presenters. I'm going to hand this off to Walt Pickett to say a few words about Digitech and get started with today's presentation. Walt, it's all yours.
Thank you, Anthony. Hello, everyone. My name is Walt Pickett. I've been with Digitech for over 28 years and I'm currently the Chief Operating Officer. Before we kick things off, I did want to take just a minute and tell you a bit about our company. Digitech is the country's premier provider of billing service and technology to the EMS industry. We were founded in 1984 as a software company, and soon after that, we started working with the medical transportation industry. During that time, we provided software for call taking, dispatching, and billing. For clients to do the billing themselves. Also during that time, we learned that there was a need from our clients and also from the industry for billing services. So in 1994, we began offering fully outsourced billing services. And today our client base is made up of municipal EMS fire departments, hospital ambulance services, as well as private ambulance organizations. Our focus has always been on maximizing collections for our clients, providing top-notch reporting and compliance. And really the secret to that is our billing platform. Our billing platform is something that we've developed in-house over the last 30 years, and it allows us to be incredibly efficient in our processes, and it allows us to customize our services to meet our clients' needs. In addition to these services, we also support our clients in areas such as audits and cost reporting. We're grateful for the opportunity to talk to you today about the important topic of the ground ambulance data collection system, and we're excited to have some great speakers involved with the webinar. With that, I will turn it over to Michael Brook, who will introduce today's speakers and lead the conversation. Thank you.
Thank you, Walt. Thank you, Anthony. And thank you, everybody, for attending. We appreciate the partnership with Fitch and the opportunity to spend the next 50 or so minutes talking on this topic. So the reason why we felt this was pertinent to have this conversation today, this requirement for cost reporting has been on the radar now for over 5 years. But in talking with current clients, we have found that agencies are at varying states of readiness and involvement, engagement in the cost reporting activities and exercises that are mandated. So we want to take this opportunity. We're not going to go through super detailed information. What we want to do is provide some context and we've got some clients who are in the process of doing the cost reporting, sharing some insights that they've learned and some expertise that we have within our organization on best practices. So let me move forward here to introduce our speakers. Sorry here, I'm having a, oh, there we go. I'm Michael Brook, Senior Vice President of Client Relations. I have the privilege of working with some of the largest municipal agencies in the country and also working with thought leaders across many of our clients who are helping to lead the EMS industry. Joining me in the presentation today, I've got a few individuals here. We've got David Mead, who leads our cost recovery solutions practice. David, do you want to say a quick intro?
Sure. Yeah, David Mead. I'm the Director of Cost Recovery Solutions here at Digitech. So in this role, I help our clients with the GADCS reporting as well as the Medicaid cost reporting. So it's a very exciting time, really great opportunity to be able to provide this information to CMS, and hopefully we'll see some changes in the rates that come from this.
Great, thank you, David. And then joining us as well, we've got Chief Neil Dwyer from Burnsville Fire. Chief Dwyer.
Yeah, thank you, Michael. Hello, everyone. My name is Neil Dwyer. I'm the EMS training and Assistant Chief for the Burnsville Fire Department in Burnsville, Minnesota. Thank you.
Great, thanks. And then finally, we've got Thomas Moore joining us from UMC. And do you want to introduce yourself, Thomas?
Certainly. So my name's Thomas Moore. I'm the Director of Emergency Medical Services at University Medical Center in Lubbock, Texas, and a junior partner with Fitch & Associates. Pleasure to be with everyone this afternoon.
Wonderful. So what I'm going to do is just spend a few minutes. I want to talk a little bit about what we're hoping you get out of this webinar. And I'll start out by saying that we definitely want your engagement. Please put questions into either the chat or the Q&A. We'll leave time we're sure there's questions out there to engage in those as best we can. And if there's any overflow, we'll have a process for following up afterwards. So the goals of our webinar today are, we want to make sure agencies understand that you do have a reporting requirement, right? This is mandatory. This is not optional reporting. If you do not report, there is a penalty associated with it. And we want you to have a little deeper understanding about what needs to be reported. And like I said, we're not going to go into granular detail on that today, but we just want you to hopefully some of you have a better grasp if you're not already well into the process. Another important takeaway we're hoping is so that you can learn from the some EMS agencies who are in process of doing that. So that's what Chief Dwyer and Thomas are going to talk about and share some of their insights. And then David Mead's going to share insights that he's gained and working with numerous clients and agencies on their cost reporting efforts. So I find it's helpful on some of this to talk about where we are in this process, because sometimes we get knee deep into the effort and don't understand the context of why we're even undertaking this process. So right now, if you look back at the history, there's been a lot of debate about reimbursement for ambulance services. And this goes way back. So back in 2002, Medicare implemented a national fee schedule. So prior to that time, there were split fee schedules, and it was really bifurcated based on whether an agency was hospital-based or whether they were a standalone transporting agency. So there was a standardization of the fee schedule. As far back as 2004, temporary Medicare ambulance bonus payments were identified as needed. So there was some early on acknowledgement that even though there was a national fee schedule, that there were some shortcomings in ensuring that agencies were being paid fairly for the cost of providing the service. In 2005 and 12, there were GAO cost studies that were conducted. I'll come back to that in a little bit. And then what gets us all the way to where we are today is that in 2017, there was legislation that took effect in 2018, the Bipartisan Budget Act of 2018. And it did a couple things. One of the things the industry was pushing for was an extension of temporary bonuses. But when Congress extended those bonuses, they imposed a reporting requirements on the industry. And so that's really what pulls us forward to why are we doing this cost reporting now? And we'll get on the timing here a little bit because COVID's played a little role in slowing things down. I mentioned I'd come back for a moment to the GAO report because I think there's a couple of interesting aspects to it. So when the GAO did their study, there were a couple things that happened. One is they carved out all fire-based agencies because they felt like the commingling of costs was too difficult to deal with. But as you all know, that is cutting out a substantial number of providers in this space. Probably not, certainly not representative of what needed to be studied in the analysis. And even then in that study, they said half or more of the EMS agencies, and that's excluding fire, would not be able to cover their costs with Medicare's current reimbursement. So one of the things that I found interesting is in that study, the range was huge. So the range of costs that were reported went from the low end at $200, just over $200, and at the high end, it went over $2,200. So, you know, even back over a decade ago, there was this vast discrepancy in what it costs providers to be able to roll an ambulance and transport patients. So I mentioned the legislation was put into effect in 2018, and so how do we get to 2023 where we're still talking about the cost reporting? So initially, when this was rolled out, the plan was to collect the cost data over a 4-year period, and agencies were randomly going to be selected in year 1, 2, 3, or 4. We had a little road bump called COVID that caused lots of disruption in many areas, including this. So it resulted in delay in the cost reporting time period. And ultimately, as we got through, it's hard to say we're completely through, but through the hardest parts of COVID, there was a relook at how this program would roll out. So what the decision was to consolidate the collection of the data over a 2-year period. And any agency that was selected in year 1 or 2, and CMS published lists. So if there's any agencies out there that are unaware that they've been selected, there are lists available that you can go and find out what year you were in. You should have been notified as well by your Medicare administrative contractor if you were selected. So those agencies selected in year 1 and 2, their reporting period is 2022. And there is an option that was presented to those agencies to choose either a calendar year or a fiscal year. Once you do the reporting, so let's say your calendar 2022, your reporting period would be January through December. And you don't input any data during that time, you're just collecting data. And then after your reporting period ends, so that'd be January 1st of 2023, you have 5 months to submit the data into the ground ambulance data collection system. And so that means by the end of May, any agency that was calendar 2022 needs to have their data submitted. If you are a year 3 or year 4 agency, your scenario is similar. It's just your reporting period is either calendar 2023 or fiscal year 2023, and you have that same requirement of submitting the data within 5 months of the end of your reporting period. At a very high level, like I said, there are 13 sections in the ground ambulance data collections system. But at a high level, those 13 areas are clustered into 4 areas. there's a section around organizational characteristics, fairly straightforward. It's your organization's name, national provider identifier, so just basic information about your organization. There's a section on response data. A lot of agencies are pulling from their CAD. This is things like what zip codes did you respond to? What are your response times? So that's the type of data that is required there. Really the biggest bucket and the most challenging bucket of the reporting is the cost, which you can imagine since this is a cost exercise. And then there's also a requirement to provide revenue data as well. Okay, so what happens if you do not report? So here's the hook and the teeth, the stick that's behind the requirement to report the data. If an agency is selected, and it's not just if you don't report at all, but if you don't sufficiently report your data, you are subject to a 10% reduction in Medicare payments during the next year. And I saw something that, in the ballpark, just to give you a sense, if you're a 10,000 transport agency, that might be in the ballpark of $100,000. And we know that, that's a substantial amount of dollars for any agency to have to deal with. So our goal here is to help you all make sure you're compliant, getting the data that you need to, and reporting it in a timely manner and as accurately as possible. So before I move forward from here, we want to do a quick poll just to get a sense of where everybody's at in the process of collecting their data. So you've got 4 options here that you can choose from as where you're at in this process. One is you're done. I'm suspecting there's probably not too many that are all the way through the process. The instrument opened for reporting in January, but there certainly could be some agencies that are there. We're in the middle of the process somewhere, so working on it. Not started yet, still have initial conversations and planning, so trying to get everybody mobilized. And then the far end of the spectrum, trying to figure out what in the heck that we're talking about here. What is this ground ambulance data collection system and what do we need to do? So we'll give it another 15 seconds or so. It's not a super complicated poll to see where everybody's at. All right, Amy, does it look like you've got a fair number of responses in? So let's see the results. Okay, so look at that. We've got a couple of folks who are on that have submitted everything. So they get a star for being really on top of things. I'm sure they were calendar year reporting, got their data, submitted it. The biggest chunk of folks, which, given where we're at, if you were a 2022 participant and you're in the not started, still having initial conversations, you're a bit behind the 8 ball, right? So 2022, again, if you selected fiscal year, you're probably still in your reporting period right now, but the clock is ticking. And then we have a handful of people who are trying to figure out, what this is about. So hopefully we'll accomplish that during this session so that everybody can move out of the what is Grand Ambulance Data Collection System. All right, so real quick here, want to provide everybody with some tools especially if you're in that last category and trying to figure out what in the heck we're talking about and what in the world the requirement is. So CMS is a useful resource for getting some information about the cost reporting requirement, and the GADCAS tool is live. There's documentation around that. On the CMS website, there's webinars that have been conducted, and you can access those in order to educate yourself more on what is required. What we are hearing, though, is I know the documentation, for example, on GADCAS is well over 100 pages, so I get that it's very technical in nature. So sometimes just being able to step back a little bit and listen to what others have experienced and what some of the experts are seeing is very helpful. So hopefully we'll touch on those areas during the webinar. Industry organizations, there's a number of organizations out there that are doing a combination of things, webinars, in-person workshops. This organizations like the American Ambulance Association. I know they've been doing some road shows trying to help agencies better understand what the reporting requirements are and how to go about doing it, and to get into the weeds on how you allocate costs, for example. There are also technology tools. So, for example, we have a reporting tool that is within our billing platform for our clients to allow them in this utility. They can, the system will automatically pull certain information. Remember how I mentioned response zip codes? So we'll pull that information in automatically to help our clients with their reporting needs. But there's also the ability to put all the information in here to have a repository, because ultimately what you're going to have to do is log into the GADKIS tool and input all your information, or have a consultant assist you in that process. And so you need a place to store your information. Again, American Ambulance Association for its members has a tool as well. And there's a couple other tools that I've heard of as well. Again, this is just individuals, organizations trying to help agencies be able to organize their data for submission. And then finally, there's consultants in the space here to help agencies that need assistance in organizing and understanding what the data is that they need to pull. In the end, the cost data obviously is your agency's cost data. But the consultants can provide expertise about how to, especially when you're doing things like allocating costs and what some good practices are associated with that. And David will talk a little bit more in a bit, but Digitech has David and his team available for agencies that are looking for that kind of assistance.
Michael,
Okay.
before we move to experiences in the field, we had an interesting question. Somebody said that their agency hasn't been selected at all and wondered any idea how many entities are in that position. So maybe you can say something about who should have been selected.
Yeah, and David, feel free to chime in, but my understanding, and it was probably point in time, is that every agency that has an MPI that is registered with Medicare, CMS, was in the pool to be selected. So one scenario I've seen, if you're a new agency, so if you've just started transporting relatively recently, that might be one, relatively recently, might be in the last couple of years, that might be a reason for you not being selected. And it may be worth your while to make an outreach if you believe you should have been part of this. I don't know if this agency is gone. There are the lists out there, so I definitely would double check against the list, because we have heard of some agencies that were not notified by their Medicare administrative contractor yet. We're on the list. David, any other scenarios that you've seen as to why agencies haven't been selected?
So we've seen a few of our clients that have not been selected, and just to be honest with you, we don't know why they weren't selected. Now, I think the question that we got in from Mr. Farmer, so that is a relatively new agency, so I understand that they are just starting to provide Medicare transport, so that's the reason that they didn't get selected. So, yeah, there are a few agencies out there that, for whatever reason, they got missed in this initial request.
So I guess you can count yourself as lucky, potentially. Let everybody else pave the way on this. So yeah, but if you were not selected, then you are not subject to the reporting requirement. But as I said, I definitely would double check to just confirm you're not on the list. But yeah, it has happened. It doesn't surprise me that there would be some exceptions. Anything else, Rachel, we need to address before we move forward?
A couple other questions, but I think we'll get to them maybe a bit later during David's portion.
Okay, perfect. Sounds great. All right, so we want to get you over to hearing from some folks that are knee deep, neck deep in the process here, and some of the experiences they've had. So Chief Dwyer, I'm going to hand it over to you so you can talk a bit about your experiences so far.
Yeah, thanks again, Michael. Yeah, thanks for giving this opportunity as well to kind of share a little bit about what our experience has been like to this point. Just a little context about who we are and a little background about who we are. The city of Burnsville, we're a suburban community just south of Minneapolis, St. Paul. If you haven't picked up from my accent yet, that is in Minnesota. We serve an aging and relatively diverse population, just over about 64,000. We're a fire-based ALS service made up of 50 firefighters and paramedics responding on 3 ambulances and 2 engines daily. Last year in 2022, we did about 9,100 emergency calls, with roughly 7,100 of them being EMS. We ended up billing about 3.2 million. And with a large chunk of that being Medicare, we knew that we didn't want the potential 10% penalty that could come with our non-compliance in this. So when it comes to our process, here's a few things that we discovered, and I certainly hope that it helps some of you as you continue to navigate this. Pre-planning has been key. Obviously, we knew this was coming for a while. We had the little COVID break, but we've really been working on this. It was last year, but for several months, we've been kind of starting to gather all these things. I've been incredibly fortunate to have great partners from the beginning. Our fire admin assistant, Deb, and Michelle from our city's finance department, who are both on here today, I believe. Give them a shout out because they've been doing great things for us. And also partnering with Digitech, who is our billing company. They've been a great resource for us. We knew at the beginning it was going to be a priority for us to gather the correct information. We didn't want to guess on anything. We wanted to be as accurate as possible. And so with that, we started by reviewing, each section, identifying the exact information that was being requested. And we quickly found out that we didn't have all the answers between Deb and Michelle and I. We quickly recognized that we needed some more help from some other entities within our city. So we ended up reaching out to our fleet maintenance and our human resources department, and they helped us along with Digitech get through this. As far as the resources that we found useful, honestly, it was an internal and external thing for us. Our internal system, our finance system was set up great. Each city department has to code their expenses. So we were able to compile all of the financial data that we needed right from that. Our fleet maintenance system was also a great asset to us as well, because it allowed us to track things like mileage and some of the other vehicle information that maybe wasn't in our thought process on the very front of this. On the external side, we use the Digitech tool quite a bit. It allowed us to analyze our data early, as well as ensure that we were just on the right track. It was nice because it allowed us to finish a section and then move on, or if we wanted to come back and complete an unfinished section later, we could do that as well. We were asked a few times internally and externally if there's anything we would do differently or anything we would change or any changes for that we wish CMS would consider. Understanding that and recognizing that different agencies have budget cycles that differ, but an area that was a bit challenging for us is that our finance department typically completes their audit of the previous year in May or June of the following year. So with ours, they actually have their annual comprehensive financial report done around that May-June timeline. So us trying to get this done in the first 5 months has proven to be a little bit challenging, or adding a little extra stress to those on the finance side of this. Something like this that would be helpful, that would be helpful for an organization like ours, whose budget runs in that calendar year, would be if they extended the reporting timeline, even if it was just a couple of months, to maybe allow for a little bit more accurate data. This hasn't been insurmountable for us to overcome by any means, but allowing those financial reports to be completed before this was due, like I said, would really just ensure that maybe no subsequent adjustments to the data need to be reported. And lastly, at the end of the day, it might say Burnsville Fire Department on the sides of our vehicle, or even on the bill that the patient receives, but this is really, it's really taken all of us, internally and externally, in order to get this accomplished, to get it done. It's actually started, this whole process has actually kind of helped us by forcing us to, both the city and the fire department for that matter, to take a deeper look at the services that we're providing, specifically from like the cost analysis perspective, but it's going to help us make more informed decisions and improve our goal setting moving forward. So in that respect, it's been a good process. So, with that, I'd say I'm definitely grateful to be moving near the end of this process. I think we all are. And we really hope that that everything you're hearing and seeing today is going to help make it easier for all of you. So thank you for your time.
Thank you very much, Chief Dwyer. That's very insightful and helpful. All right. All right, Thomas, you want to take us through your experience so far at UMC Health System?
Yes, certainly. So once again, it's a pleasure to be with everyone this afternoon. And I really just want to share with the group a few brief suggestions based on our experience with the ground ambulance data collection process, so that hopefully you can perhaps take something that's actionable from this that will assist your organization. And really what I'm going to speak on can essentially be distilled into 3 salient focus areas. The first one is to ensure that your organization is set up to maintain all of the necessary data. Our organization services a population north of 320,000. We have several cities that we service. We're hospital based. And so when we speak about what these data elements may be, that could be staffing and labor cost, facilities cost, vehicle cost, equipment and supply cost, service mix, payer mix, revenue and response data. And so one of the things that we did kind of early on is we established a repository for all of the cost and revenue data elements, really worked hard with our our partners at Digitect, our internal and external accounting entities. And we reviewed what was required to ensure that what we currently tracked and the way that we track those elements were actually consistent with what the requirements were. One of the things that we know just from being in the industry is that nomenclature varies from locale to locale, from state to state, with respect to what you call certain things. And so we wanted to make sure that what we tracked and maintained and measured was consistent with what was required from a reporting aspect. The second piece that we found to be beneficial is to ensure that you know who's responsible for collecting, maintaining, and reporting that data. And so what we did is we kind of met early on with our internal accounting and decision support teams to establish roles and responsibilities with not only those individuals, but our third-party entities, financial institutions, so our external auditors, and then our vendors. Like I just mentioned, our partners at Digitect. Meet early and often with those groups so that we could establish a rapport, determine who is going to track what. We did a governmental relations finance department within the health system itself, and they track things for ambulance uncompensated care and other UC programs and charity programs. And so we knew that we wanted to make sure that our music sheet was in essence the same. We were all singing from the same sheet of music. And so we met with them, we reviewed the reporting requirements and the formats with each of those groups to ensure that everyone was on the same page. And then lastly, take the data and your reporting mechanisms for a test drive. Run a few sample reports, familiarize yourself with the process if you are going to try to undertake it by yourself, and really kind of try to determine the estimated time investment necessary for the data submission, so that you get an idea of what kind of time frame you're going to need to set aside so that you can do this successfully. And then lastly, if there are any changes based on that test drive that you undertake, figure out what those are as you continue to kind of vet out your processes, so that you can ensure proper data submission when it is time to click submit and get everything in the system. And those are really the things that we feel like from a sharing success perspective were most advantageous and really got us the most bang for our buck.
Great. Thank you, Thomas. Rachel, any questions popped up that you feel like we should address now versus holding till a little bit later?
There are a few tactical questions that I would love to be able to get to if we do have time at the end. So I will kind of hold on those. But before we launch into David's portion, or maybe David, something that you can weave in, we got a question about whether there were any similarities with this program and GEMT funding that CMS offers. And then there was also a question about getting an extension on the reporting time frame. Somebody says, they discovered that the notification letter went to an old address, so puts them behind the 8 ball on getting it done. So I thought those were 2 good questions that maybe we could touch on best practices. And for everybody else who asked questions, we'll definitely try to get to yours, time permitting.
Okay, great. David, why don't you run with it and see if you can weave those in as you're covering your material.
Sure, absolutely. All right, so obviously some really good insight there from Chief Dwyer, Mr. Moore. I think it's really helpful to hear how different organizational types are really managing this process. So, just seeing how they approach the different GADCS requirements, I think is helpful for everyone here. Keep in mind that they come from very different types of systems, a municipal fire-based system, and then also a large hospital-based system. So it also, I think, highlights some of the challenges that CMS really had with this process when they designed the collection instrument. It's impossible to make everyone happy. I definitely understand that, but I think it was really important for CMS to design an instrument that they could use with all ground ambulance organizations. So, it's a very difficult process that they went through, and I know that we've heard a lot of complaints about the utility, the instrument that we're using, but hopefully what you can capture from our discussion today will hopefully help you with completing that instrument. So regardless of what type of organization that you come from, I think there really are some commonalities that all agencies can utilize to prepare for this process. So we'll take just a few minutes to present some of the best practices that we've seen, and hopefully you can walk away feeling a little bit better prepared about how to start handling this project. So I thought I would start out here just based upon my experience and to try to answer one of the questions that came in. So my experience really is on the Medicaid cost reporting side, or the GEMT cost reporting side. So the GADCS requirements, these are all brand new, so we're all seeing this for the first time, but there are some lessons learned that I think you can take from the GEMT side that will also play into the GADCS reporting as well. So if you are currently participating in one of these, the Medicaid supplemental payment programs, there are, some of the data that you're already capturing for that GEMT process. You should be able to transfer some of those same calculations over to use for the GADCS reporting. So, for example, looking at the allocation methodologies, so as you pull the CAD data and you're having to determine, how are you going to allocate all of your shared costs, you should be able to use a pretty similar allocation for both the GEMT and the GADCS reporting. All the personnel costs, all of the supplies, contractual costs, much of this data will be pulled in the same way for both processes. You just have to really be mindful that there are different definitions, different crosswalks that you have to use on the GADCS instrument. So it's just a little bit different. All right, so we'll get into just a little bit about planning for your GADCS reporting. So just to kind of give you an idea of where we typically advise our clients to start with this. And our first recommendation is really to treat this like it's a project. It's not just a simple survey. So assign a project manager. Maybe that's you, and maybe that's why you're here today. Maybe it's a financial or data analyst that's within your organization. But plan ahead, plan some more. Really, planning is going to be critical for this, and there's no such thing as starting too early. So if you were selected for year 3 or year 4, meaning your collection period hasn't even started, right? It's going to start sometime later here in 2023, perhaps. You may be tempted to wait on this process until just a few months before your reporting is due. Please don't wait that long. There may be some on this call that are also, they were selected in year 1 or year 2, so they were in that first cohort, and you're just now starting to turn your attention to this. You're trying to determine how to capture all of this data in the next couple months. Regardless of which side you fall on from this timing perspective, you really need to establish a communication plan and a data collection plan. So, I know that Chief Dwyer went into this a little bit, and Mr. Moore did as well, but determining what data is required is very important. So review the GADCS tool, understand what data you need to start collecting, communicate that to everyone that will be in your stakeholder group, communicate when you need to provide that data as well. So the other thing is, once you have established, these are the sources both internally and externally who we need to go through or go to obtain this data, then make sure that you get everyone in the same room, make sure they understand their role, again, when the data needs to be produced, and when they need to come back to the table with all of the data and the calculations to input into the instrument.
David, we got a good question that ties
Sure.
into this, and I think I may know the answer, but I'd rather have you answer. Is
Sure.
there a sample form of this so we know exactly what is required to be submitted?
Yes, well, so if you go to the CMS website, you will see that there's a copy of the instrument on there. There's a PDF of the instrument, and then you can also go through an FAQs document that's on the CMS website. I think that's a good place to start as well. There's a lot of information out there. Just kind of keep that in mind. But so again, starting early, reviewing what you need to review in that GADCS instrument is really going to be a key here. Okay, so let's talk just a little bit about the official roles and responsibilities. So your agency's GADCS project manager, the PM who is going to lead this work, really should be working on establishing clear expectations for everyone's roles, right? So access to the CMS portal can be established under two different roles. So we're going to talk a little bit about kind of the official roles here, but there are submitters, and then there are certifiers. So submitters are going to be responsible for data entry. And I would imagine that, these submitters will also play a key role, not only in entering that data, but probably in the collection and analysis of that data as well. So, just kind of keep that in mind, that submitters will probably wear different hats here. You'll want to have at least two submitters. I would have one primary and at least one backup, and assign those roles as soon as you can. So as soon as you determine, these are the folks that we want to have access to the CMS portal to start entering data, assign those so you can start with that. In terms of the certifier, so the certifier is usually going to be the director and maybe the owner of your agency, EMS chief, fire chief, could be someone else within the county or the municipality, but it may also be the CFO or the finance director as well. So a lot of the data is going to come from finance. Finance may be the department that's going to sign off on this. So the certifier, as the name indicates, provides that final certification and submission. So make sure that they are going to be around, coordinate schedules, make sure they'll be around to be able to review what has been entered into the CMS portal, and that they have time to sign off. Make sure they're going to be in the office, make sure they have availability, especially if you're coming down to the wire on this, right? So just a little bit more about that certifier role. So, and Michael touched on this just a little bit, but that 10% payment reduction for not participating in the GADCS. So that applies for organizations that do not submit any data at all, and also for those that do not sufficiently report data. So just kind of keep that in mind. The point that I'd like to make there is just accuracy, quality matters with this process. So, that certifier actually has, a lot of responsibility attesting to the data that's going to be entered into the portal. So,
David, can the same person be both certifier and submitter?
I believe you can. Yes, I don't know that we've seen that in very many places, but yeah. Good question. Okay, a little bit about the timing. So we get a lot of questions from folks about how long GADCS data collection and reporting will take. And of course, there's no easy answer to this question. It really depends on a lot of different factors. There's organization size, the organization type. Do you have to allocate cost? That's going to take a little bit longer if you're having to allocate cost. How accessible your data is, the quality of your data. All of these factors really impact the level of effort that's going to be required. Now, CMS estimates that the average agency will spend somewhere around 20 hours collecting this data, another 3 hours to report the data. And, it'd be happy to check with Chief Dwyer and Mr. Moore, but I would assume that they probably do not agree with this statement, that it takes a lot longer than just 23 hours for this. And that really is kind of the consensus. So again, goes back to really underscoring how long you need to, how well you need to plan for this. So plan ahead as much as you can, make sure that you're able to pull all of the data that you need to pull, and note that there are some things that you can work on before the collection period even starts. So kind of testing your data, running some initial tests on the data that you have available, what you can pull ahead of time. There are some pieces like the odometer readings for all your vehicles that you need to pull on day one of the collection period. So again, that can't stress this enough. Just don't wait until your collection period closes to start working on this. Start early. All right, so back to the basics just a little bit. So we'll kind of wrap this up. So what do you need to know or take from this? So if you're not the billing manager or the person responsible for Medicare reimbursement, find out who is responsible. Did they receive the notification letter? Did they respond to the notification from CMS? Do you know your deadline for submission? So we've had some folks that they think they've responded to the initial submission, but they are not sure. So if you're not sure if you've responded to that submission or you don't recall what your deadline is, email the GADCS help desk. They should be able to give you that information. Determine what data you need for the survey. Again, figure out if you're collecting every data point that you need to submit. I think this is probably unlikely for most folks. So, work with your finance, your operations, your HR teams, fleet maintenance, all of your kind of internal departments, and those external vendors like your billing vendor to start collecting what you need to collect for this project. And if you have the resources in-house to collect and report the required data, that's great. Make sure that they've got the bandwidth, that they've planned for this, they've got the knowledge to be able to work on this. If internally you don't have those resources, then think about you can consider adding some outside resources to assist with the process. And there are definitely some resources out there that you can connect with to get some help with this process. And we'll take a quick look at the penalty for not sufficiently reporting the data. So we have an example there on the slide there. In this example, we look to kind of quantify what it looks like for a typical ground ambulance service. So if 35% of your transports are for Medicare eligible patients, you've got 10,000 transports. These trips pay on average $300 a transport. So your Medicare revenues would be just over about $1 million per year. So a 10% reduction in revenues, $100,000 in lost revenues. It's a pretty significant loss. There's no doubt about it. So, and then, I think the other way, another perspective of being able to look at this. So, this is really your chance, and it's the entire ground ambulance industry's opportunity to demonstrate to CMS the true cost of providing ground ambulance services. So, this is the shot that we get to be able to provide to CMS proof that the current reimbursement is inadequate. So, just ask that you do your part with this. If you need help, there are resources out there that can help with this as well. So, so make sure you make the most of this and really give it your best effort to identify all the costs that are involved with your ground ambulance transportation.
One related question to this impact, I suppose, was how does CMS determine if insufficient or I guess inaccurate data has been reported?
Good question. So we do expect that there will be a desk review or audit process that's associated with the submission of this data. Now, with that said, there's more than 10,000 agencies that have been selected for this process. We don't know how in depth that audit will be, but we do believe that there will be a review of this data. The other thing that I would point out, there are some pretty clear checks that they've included in the instrument to be able to verify, for example, that you have entered all of your costs into the various sections in the instrument.
Great. We're coming up here on the Q&A section. One thing I thought I would comment on, David, your emphasis of this is our chance as an industry to be able to communicate with specific data to CMS, the costs associated with doing this. When that 2018 bipartisan budget act was passed that put this process into place, the Congressional Budget Office assessment of the budget impact, and remember this extended the temporary add-on payments, was that over a decade, this would save $1 billion for the government. So clearly, there's some individuals that think that the payment, or when they did the analysis, the payments would go down. I think most of us in the industry believe that the Medicare reimbursement is substantially below the cost of providing the service. So very interesting. So I'm going to wrap up here just on resources, and then we'll go into a Q&A. There's a bunch. David, thank you so much for providing insight on the resources. I'm not going to repeat them, but because I think we touched on them a couple of times here. But there are a bunch of resources out there, and we think a critical decision that you need to make, and the analogy we're using is taxes here, right? It's tax season. You need to decide, do you have the expertise and the time to find the tool and put all the information in and do your analysis and make sure you submit correctly to the IRS, or do you feel that you need some experts to come in and do your taxes for you? We kind of view this exercise the same way. And at the bottom of the slide, if you've got follow-up questions or want to reach out, we've got our email address that gets you to the team that is focused on the CMS data collection process. And I'm sure something David would share with you is sometimes you don't know what you don't know. That's why he is emphasizing get started early. You're going to have questions that come up as you go along. You're not going to know them all right out of the gate. So with that, I want to go to Q&A, and if I could, Rachel, I want to real quick pull on something that David talked about and throw it back to Chief Dwyer and to Thomas. And you guys may not have a good estimate, but number of hours, right? CMS said they thought it was 20 hours of collecting the data and 3 hours to input it. I don't think you guys are at the input stage, but do you have a order of magnitude estimate of what you think it's taking your organization to get where you are now?
I guess speaking from our side of things, this time around, there's more hours, I think, invested because we're still trying to understand everything. So I would say the low end would be where you guys are at with the 20 and 3. Would be my guess. When you divide up, we've had many hours between, like I said, our finance and our admin team looking at all this stuff, but then the maintenance side they've been working on all this. So all these hours add up. And I would say that we are definitely well over the 24 hour mark going into this.
Thomas, you have any estimate for you all at UMC?
Yeah, I would say probably somewhere in the north of 50-hour range.
Yeah, I appreciate you guys sharing that, just because it gives, David's vaguely saying it's significantly understates, and I think we feel strongly on that. But just give a sense, and you guys aren't complete with your process either, right? You're still in process of doing it, so that's to date, and you're still working through, and probably still working through some of the harder pieces of it. So, great.
Certainly.
All right, Rachel. What other questions do we have out there that we can start to tackle here? We've got about a little less than 5 minutes.
Right. So I know I'm positive that we're going to run out of time. So I do want to, maybe if you could flip back, Michael, as we are answering questions, to the slide that had that email address on it, just so that if, there's any questions, we're happy to help. And one question that just came in that I think is kind of relevant to all of this, we have several outstanding questions that the published literature does not address. How do we contact a live person at CMS to assist us with the questions? In emailing the CMS data collection email address, all we receive is a generic reply, and we need specific questions answered in order to accurately report. I don't know if we have, a direct line to CMS, but I wanted to throw that out there, since that kind of covers a lot. And I'm sure we've all been in this position with trying to get questions answered.
So, and I think probably the best place to go with that. So if you want to just shoot those questions directly to us, we can try to address those questions. If we still have, if we can't give you the answer, we'll go to CMS and see if we can find out. I understand that they may not always give you direct answers. So.
Yeah, we'll try to use our power in numbers. We had a couple questions about the penalty. So how do we know how long, if data is inaccurate or not submitted, how long is the penalty period, and how do we undo the penalty?
I think they've stated 1 year, right? So for a 12-month period, you'd have the penalty. It's a fair question, because we're not into it, right? But based on what they've said, it appears to be a 1 year period where the payments would be reduced.
And it only impacts the Medicare revenues. There's no impact on the GEMT program at all.
All right, and then I think probably just time for one last question. I know this is somebody who asked really early. We are currently in the process of our data reporting, and came up with a question regarding expenditures. So they received grant funding the year prior to the required reporting period, and then expended the funds during the reporting period. Do they include those expenditures even though grant funding was received the prior year?
So yes, I would go ahead and report those. So you're going to report the expenditures. I'd go ahead and report the grant funding as well, to indicate that that's what that was from.
And I want to give our friends at Pinnacle a minute to wrap up. So I will just say, for those of you who didn't get your questions answered, we'll be sending out, or there'll be a recording of this available to you. And please do let us know, send an email to that email address, and we'd be happy to help.
Great. So Thomas, I think that gets us to the end. We're right up on the top of the hour. Oh, I'm sorry. I mean, Anthony, that puts us at the top of the hour. Sorry.
No problem, Michael. Well, thank you guys for a fabulous presentation today. That was very enlightening. And I know that our audience today had a lot of really great questions. I'm sure you'll be getting some emails about that, but definitely gives us a lot to work with there. So again, thank you so much for taking the time and sharing your expertise with everybody. And thank you, Digitech, for your partnership and for bringing this great content to us again this year. I'd like to also say thank you to our learning partner, Ninth Brain, and our premier media partner, EMS One, once again, who always help us with the Pinnacle webinar series. And in case you missed it at the beginning of the announcements today, registration is now open for Pinnacle 2023. This year's Pinnacle will be held July 24th to the 28th in San Antonio, Texas, at the beautiful JW Marriott Hill Country Resort. Don't miss exclusive pricing. It's open now through April 1st. You can register at pinnacle-ems.com. And spots are still available for our upcoming Ambulance Service Manager and Communication Center Manager courses. If you're looking to advance your own leadership skills or facilitate the next generation of leaders in your organization, learn more about these opportunities at fitchassoc.com. The program begins August 28th, with in-person classes being held October 8th through the 13th, and week 2, December 3rd through the 8th in Oklahoma City, Oklahoma. Be sure to join us next month for our Pinnacle webinar series, Identifying Trends in Your Data, sponsored by ImageTrend. The presentation will be held 1 week earlier than usual at 1 p.m. Central, Tuesday, April the 11th. You can register at pinnacle-ems.com. Thanks again, everybody, and we're going to see you next time. Be safe out there.